Welcome to The Explainer. Today, we're diving into something that is absolutely vital, but honestly, it's so often ignored. We're talking about women's joint health after 40. Look, if you, or maybe someone you love, has been dealing with these sudden, really unwelcome physical changes, well, you're in the right place. We're going to decode the source material together so we can understand exactly what is happening inside the body.
Okay, let's dive into this. Have you been feeling achy lately? Like, have unexplained aches and pains just suddenly become this unwanted companion in your day-to-day life? Maybe your knees kind of twinge when you take the stairs, or your lower back aches after sitting for just a short while? Well, if you're nodding your head yes, I need you to know this isn't just some random occurrence. You are definitely not imagining things. What we're looking at here is a very real, scientifically documented biological shift.
So, how do we make sense of this shift? Here's our roadmap for today. First, we'll look at turning 40 and the pain. Next, why women are disproportionately affected. Next, the early warning signs you need to look out for. And finally, solutions and treatment. Let's get right into it.
Starting off with Section 1, turning 40 and the pain. You know, hitting your 40th birthday, it literally marks a biological new chapter for a woman's body. It's a major transition phase, and it requires us to switch gears from just passive maintenance to active management of our health, especially when it comes to our skeletal system.
Just 1%. I mean, it sounds like a tiny fraction, doesn't it? But get this, that represents the potential annual loss of bone density that women can face right after turning 40. Think about that for a second. Imagine losing 1% of the structural integrity of your body's foundation every single year. It's a seemingly small number, but it builds into this massive compounding impact over a decade or two. And honestly, this is exactly why those sudden aches start creeping in. And this brilliantly illustrates the stark reality we're dealing with. Women actually have a 4 times higher risk of developing osteoporosis compared to men. 4 times! That is just a staggering difference. It really highlights exactly why early prevention isn't just, a good idea, it is an absolute necessity. But seeing this massive gap begs a pretty huge question. Which brings us to Section 2. Why women? We really need to put on our medical detective hats here and decode the specific biological realities that are basically stacking the deck against female bone health.
The source material points us straight to 3 core factors. First up, hormonal changes, specifically during perimenopause, which is a phase every woman will eventually navigate. During this time, estrogen, which is normally this great protector of your bones, starts to drop. Second, pregnancy and childbirth. Obviously an incredible journey, but it profoundly changes your spinal structure and puts an immense load on the body. And third, just a simple physiological reality. Women naturally have a smaller and thinner bone structure compared to men from the get-go. It's a baseline reality, which means there's less bone mass to spare when that 1% annual loss kicks in.
So how do these factors actually play out? Well, they lead to common pathologies like osteoporosis, osteoarthritis, and disc issues. But what's truly fascinating are the hidden mechanics behind all of this. For example, women naturally have a wider pelvis, right? Well, that wider angle actually alters the mechanical pressure placed on the knee joints every single time you take a step, which increases the risk of knee osteoarthritis. And all that immense pressure from pregnancy we talked about, that can directly affect the spinal discs. It's like a giant puzzle. Everything is connected. Moving on to Section 3, early warning signs. Look, our bodies are highly intelligent. They are constantly trying to tell us when the system is under strain. We just have to listen to them. Let's do a quick mental checklist. Are you experiencing morning stiffness that lasts longer than 30 minutes? How about random joint swelling? Or maybe a pins and needles tingling sensation in your hands or feet? Do you ever just have this unexplained bone-deep fatigue? Or, and this is a really common one, do your joints ache more when the weather changes, basically making you a better forecaster than the local meteorologist? Seriously, do not ignore these. They aren't just you getting older. They are specific, targeted signals your body is sending you right now.
If you were just nodding along to any of those symptoms, your next step is absolutely crucial. You need to get checked by a professional. And hey, don't worry. Diagnosing this isn't always about massive, scary machines. Doctors use brilliantly simple diagnostic tools to crack the case. Take the straight leg raise test, for instance. By literally just lifting your leg in a very specific way, a doctor can pinpoint the exact root of your back or leg pain. And identifying that true source, that's the only way proper, effective treatment can actually begin.
All right, Section 4, solutions and treatment. We've looked at the hard facts and we know the risks. Now, it is time to take back control. The source material is crystal clear here. You can proactively build a shield for your joint health. And the best part, it relies on everyday choices that are entirely within your control. We're talking about eating a nutrient-rich diet, doing targeted exercises to strengthen the muscles that support your joints, maintaining a healthy weight so you aren't putting unnecessary load on your body, just being mindful of your posture throughout the day, and committing to regular health screenings. These habits, they literally make up your everyday armor.
But among all those pieces of armor, there's one golden key: regular bone density screenings after age 40. This is the crucial piece of advice agreed upon by health experts across the board. By establishing a baseline and just keeping an eye on your bone density, you can catch that 1% decline way before it ever turns into a fracture or a chronic condition. Honestly, it is the ultimate proactive step you can take.
Now, what if the pain is already there? What if you already have a diagnosed issue? Let's clearly contrast the two main treatment avenues. And I really want to reassure you here. Conservative methods, meaning non-invasive, non-surgical approaches like physical therapy or lifestyle adjustments, those are always the top priority. Surgery is considered the absolute last resort when literally everything else has failed. Modern medicine offers incredible hope and highly effective tools long before you ever need to even think about an operating room.
So the crucial point is understanding what these conservative treatments actually look like in practice. A prime example highlighted in our source material is chiropractic care. This involves manual spinal adjustments to help restore the natural balance of your body. The real beauty of this approach is that it helps the body heal and align itself naturally, the whole shebang, completely without drugs or surgery.
And look, this isn't just theory. It builds into real-world results. Take this incredibly empowering success story directly from the source data. A 53-year-old patient who had suffered from persistent chronic pain for 20 years. I mean, 2 decades. And they finally escaped that pain after just 15 conservative treatment sessions. It's amazing. It brilliantly illustrates that even seemingly hopeless long-term cases can be managed effectively without extreme interventions. There is absolutely always hope.
We have covered a lot of ground today, right? From the hidden biological shifts that kick off at 40 to the specific vulnerabilities women face, and those proactive shields you can start building right now. So I want to leave you with a final thought to ponder. Your body is speaking to you. Through those aches, the stiffness, the fatigue, it is communicating its needs. The question is, are you ready to listen? Taking action today, whether that's adjusting your diet, finally booking that bone density scan, or seeking out conservative care, is absolutely the greatest investment you can make in your future mobility. Thanks for joining me on this explainer. Keep learning and stay healthy out there.